Good morning, everybody. It's Monday, the 13th day of July, and I hope everyone had a great weekend and an enjoyable weekend. We're going to start our COVID meeting this morning by looking directly at the numbers. It was a really tough 2 days here in the state of Florida. The number of cases has climbed to 282,000, which means that in a 2-day period, Saturday and Sunday, the number of new cases of COVID here in the state of Florida increased by almost 49,000 new cases. In Pinellas County, the numbers continue to rise rapidly. We're seeing an escalation that is mirroring what's going on in the state. We now have 11,358 cases here in Pinellas, and that 2-day increase, Saturday and Sunday, it went up nearly 20% in those 2 days. So it's clear that it's incredibly important that we focus on social distancing, wearing a mask, limiting the number of individuals we are exposed to, both trusted and unknown, because these numbers are very troubling. In Pasco County, they are stable with limited changes, and in the United States, we're up now to 3,300,000. So you'll recall in our last broadcast, we were talking about the United States reaching a benchmark and breaking 3 million. And here we are just a few short days later with an additional 300,000 cases. We are in phase 2, day 39 of the pandemic. The hospitalization rate is for Pinellas County 1,021 cases. We continue to monitor this statistic very closely. It's important because the ability of our healthcare professionals to respond to individuals who have been diagnosed with COVID is very critical to our success in preventing fatalities. We need to make sure that our ICU beds and our COVID floors are not overwhelmed, and that the hospitals will have the manpower, the resources, and the supplies to effectively treat individuals affected with COVID. We've seen an increase in hospital utilization of acute care beds. A month ago, it was down to about 30%. We're now at about 80%. And so we see that utilization is beginning to pick up. However, it is not currently in a situation where the hospitals are overwhelmed. So they're doing a good job of managing the ill and the infected. Our testing, we're at 121,000, and the percentage of positive to negative test is running 9.2%. So it had kicked down a day last week, and we thought maybe that was an indicator, but it turns out it was not a flattening of the curve. It's kicked right back up to a higher trajectory as we had been tracking. So those are the numbers here for Pinellas County and the state, and I'm going to turn now to Leslie, who will give you an update on the community numbers.
Hello, I hope everyone had a good weekend. In our independent living quarantines, we have 13 residents. In skilled nursing, we have 9. In assisted living, we have 0. For staff members that are on quarantine in independent living, we have 13, as well as in our skilled nursing, we have 9. We do not have anyone in assisted living staff that are under quarantine. Again, for our residents that have tested positive for COVID-19, we've had 2, but we've had 124 negative test results in our residents. For associates, we've had our 11 positive cases. For associates, we've had 252 negative test results for employees. Now, I wanted to go over again our isolation and quarantine differences for residents. Residents are under isolation if they have come in contact with a positive COVID-19 person or if they themselves are positive. If this is the case, you are fully quarantined to your apartment with temperature checks during the week. You are not allowed to visit any of the dining venues that are serving food. All your meals will be delivered to you during those 14 days. Now, you are under quarantine if you go to the hospital for a non-COVID-19 related stay, such as the emergency room, an overnight admission stay, or the inpatient hospital at Mies Countryside or Morton Plant. Family member's house or on a vacation, we will review your temperatures that you have taken at the front desk in the past 30 days so that we can establish that baseline temperature. If you have not been having your temperature checked at the front desk, then you will be under a strict quarantine for the 14 days where we will track your temperature during the week. You will be allowed to walk around the Regency Oaks Boulevard, but you will not be allowed to participate in any of the Regency Oaks dining venues. We will be delivering all your meals. If you have been having your temperature checked the past 30 days at the front desk, then you are under a loose quarantine. We will continue to check your temperature, but you will be able to walk around campus, go to the dining venues, and get your mail, as well as walk around campus. Again, everyone needs to still be wearing their masks at all times when you're outside of your apartment. Thank you so much. I also would like to reiterate to please have your temperature checked daily at your front desk. This will help us to establish your baseline temperature and keep track of our residents.
The next thing that we'd like to do is show you a quick video on how to protect yourself against the spread of COVID. Now, I know this is very basic information, but we want to go back and reiterate it because it is the simple things that will help protect and make sure that the spread of COVID does not make an entry into Regency Oaks. So enjoy the video, and we'll go to the screen now. Okay, so that's our broadcast for today. Thank you so much for joining us. Be safe out there, practice good social distancing, wear your mask, and we'll see you again on Wednesday.